Welcome to the event on Resist the Resistance. COVID 19 has already proven tragedy for the whole world, and yet we are feeding another recipe for another pandemic antimicrobial resistance, or also known as superbugs. Superbugs have developed resistance to one or more antibiotics, rendering these antibiotics less effective in treating infections to humans as well as to animals. Let's speak with our eminent speakers we have and know more about this issue and its impact on people, animals, environment. Today we have Dr. Jyoti Joshi, who is MBBS MD in Community Medicine and MSN Infectious Diseases, and also head South Asia at the Center for Disease, Dynamics, Economics, and Policy, as well as adjunct professor at Amity Institute of Public Health, Amity University. She is a medical doctor with a specialization in community medicine, infectious diseases, and also worked in public health programs for 2 decades. Her research interests include AMR, health systems, vaccines, especially vaccine safety, infectious diseases, emerging diseases. Her work for the scoping report on antibacterial resistance research landscape in India led to valuable projects in AMR in India. We have another speaker, Dr. Rajeshwari Sinha, who is a program manager in the Food Safety and Toxic Unit at the Center for Science and Environment. At CSE, she heads the global and national portfolio of the AMR program, focusing on the animal environmental aspects. Her work entails policy advocacy and research on issues around AMR, food systems, and sustainable food, supporting the implementation of national AMR action plans at Institute of Technology, Delhi as well. She has done PhD at IIT, and following which she has transited into working at the science policy interface in the public health space. Or another speaker is Dr. Robin Paul, who is a government public health veteran with expertise in laboratories, public health, surveillance, quality standard, antimicrobial resistance, and responsible use in animal health. He has international food safety regulations, implementing veterinary monitoring and surveillance system work experience as well. He has joined Kerala Government Services in 2002 and working currently for the government of Kerala as a veterinary surgeon. He was also involved in planning, conceptualizing, and drafting of Kerala antimicrobial resistant strategic plan. Welcome, all of you. Why don't you say hi to our viewers today?
Hello, thank you, Harsha, and
Hello
to
everyone.
your organization for organizing this today. Glad to be here.
Hi everyone.
Thank you so much. So, we will start our discussion today with some questions with our speakers. And I would like to first start with what is this antimicrobial resistance impact or this antibiotic use in people, animal, and environment? We will be talking on these three particular sector. So, my question goes to you, Dr. Jyoti. What do you think? What is the impact of antibiotic use in people, animals, and environment?
Well, I'm glad that we have a forum here today where you have experts from the animal side and the environment, and I can speak for human health. Well, antibiotics have been game changers in reducing the morbidity and mortality due to infectious diseases from, microbes. And these microbes, the most important ones that have affected humanity have been tuberculosis, malaria, and the bacterial infections, all of which lead to small issues which can lead to wounds, ultimately can lead to death through sepsis. So the antimicrobials, or as we say, the whole medicines that attack or address these microbial infections have been game changers to improve the life expectancy of the human race. They have made the quality of life much better. We are today having knee replacement surgeries. We are addressing cancer. Deliveries have become safer. And, overall, we are enjoying the fruits of development, as we say. But yes, indiscriminate use of these antibiotics can lead to harm, which we are seeing today when we say that more than 700,000 people die every year on the globe because of antimicrobial resistance, basically the resistance of the microbes, these bacteria, to the medicines that we have to treat them. And we are having very severe ICU infections, small babies, neonates, just a few days born. Almost 56,000 neonates in India are dying due to neonatal sepsis. So all these are the disadvantages of having a drug which we are not using well, and that leads to resistance. This is in the human health side. I'm sure there's similar for the animal side and even the environment, which we other extreme experts on the panel can contribute to. I'll pause here, and I'm sure that one health perspective will be useful for the whole audience that we have today on your session.
Thank you so much, Dr. Jyoti. We would like to hear more on the same topic from Dr. Robin. Why don't you share your expertise from animal aspect as well? Dr. Robin, can you hear us? You're on mute if you're speaking. Dr. Robin, you are on mute. You have to unmute yourself.
Am I audible
Yes,
now?
please. Yes, absolutely, sir.
Yeah. You looking at the contribution of antibiotics. I just want to add from where Dr. Joshi left. Essentially, it's the same when you look at animal health. Antimicrobials play a critical role in animal health, also in animal welfare and food safety. And if you look at antibiotics have contributed greatly towards animal health. You can understand that the production systems in 1950s, if we had less than 10 billion animals being slaughtered, killed for food, and now we have around 80 billion animals being slaughtered for food. So this increase in production has essentially been driven by antibiotics, and antibiotics has contributed greatly to the industrial food animal production. Because the industrial food animal production essentially relies on antibiotics as one of the inputs for increasing production. So antibiotics have played a huge role, just not from the animal welfare part of it. It has played a huge role in increasing the production manifold. You look at the production of animals, especially you look at when we look at India, the production of broiler poultry, it increases about it doubles every 7 to 8 years. So this increase is majorly driven by uh, less diseases, and to prevent diseases, essentially antibiotics are necessary. So the contribution of antibiotics towards towards food security and towards the availability of quality proteins for human beings. It has if we when we compare the vis-a-vis the human side, they say that you have added some 15 to 20 years of lifespan for human beings. Antibiotics added. Look at animal side, the production has increased maybe 20-fold due to the presence of due to antibiotics. So that is the impact of antibiotics on production. When we look at production, when we look at animal health, definitely antibiotics have a huge role, just like human beings. Animals fall sick, it's being treated. And that apart, we have a huge increase in production due to antibiotic use.
Thank you so much, Dr. Robin. So yes, I think the production has increased to a level that we were not doing it years back or decades back, and I think that is the reason that intensive farming systems have come up, and there is the problem rising of the zoonotic diseases. We will be talking about this more in our next question. I would like to ask Dr. Rajeshwari to speak about what is the impact of these antibiotics on the environment if we see it from an overall picture.
Okay, thank you, Harsha, firstly for bringing this together, for all the coordination and the work behind this. As you've heard from, the Dr. Jyoti Joshi and Dr. Robin Paul, we've heard that antibiotics have had both the positive and not so positive impact. On one hand, it has added to longevity, animal health, animal welfare, increasing human health lifespan, treating diseases. But at the same time, we are here today talking about how to resist the resistance. And antimicrobial resistance is an issue of concern. We cannot help but start talking about it. So I think the issue is the misuse and overuse of antibiotics that is happening. While in the environment, I suppose there will be naturally a reservoir of microorganisms. There will be reservoir of microorganisms which produce antibiotics as secondary metabolites, or even microorganisms which are themselves drug resistant. That is their way to That is their evasion mechanism. That is the way they survive. But once we are allowing the misuse and overuse of antibiotics in humans, animals, or even in crops, we are creating a situation where we are allowing the process of resistance development in microorganisms, particularly bacteria, if I may say, because in infection causing bacteria, we are allowing the process to speed up and enable more and more bacteria to become drug resistant. As you may know, or you may have read, that quite a large part of the antibiotics that is consumed or administered in a human being or in an animal comes out unmetabolized as part of the excreta. Or even when we are spraying antibiotics on crops, a lot of it is unspent and goes into the soil or the farm water. So all of this eventually find their way into the sewage or into the waste that is eventually going into the larger environment, and we are basically creating a pool of determinants which can contribute to developing to speeding up the resistance generation process. So I think the impact on the environment is much broader. It's much slower. It's much complex. It's not easy to see, but there is definitely an impact that's there, and it can come back to us. The environment eventually can turn into a source for us. We draw our drinking water, irrigation water, the sources that the community uses. All of it is eventually linked to the environment. So on one hand we are creating this sink, and on the other hand we will make it a source, going back to it eventually. So I would like to stop there, and I hope I've summarized the possible impact that antibiotic use can have on the environment.
Thank you, Dr. Rajeshwari. I think you have correctly summarized that actually it is a very broader issue and maybe not visible at the moment as well. We might have to make it more visible that how it is landing up to the antibiotics are landing into environment and what kind of impact it can make at a very larger level in future. I will move on to my next questions, which is we know that 75% of all these antibiotics globally, they are marketed for animal farming or in animal production and agriculture, but some of them are critically important to humans as well. So what is this link and what will happen to these particular sectors if we talk about from a human, animal, and of course environment angle, if these kind of antibiotic usage someday turn into a new pandemic?
Well, again, if I can come in first here, Harsha, what I would like to, discuss, and Rajeshwari and Dr. Robin have already touched on, is we are no longer, health or animal health or even environment are no longer silos that we study separately when we do our education, masters or undergraduation. But in real life, it's all an interconnected system. So this one health system, which speaks to each other, is the exposure that microbes, which also live in this exposed, interconnected human, animal, environment mechanism, which we call as One Health, will expose the microbes in One Health to resistance. And wherever they get that exposure from, whether it's used for human beings or in the environment, it's lying there unmetabolized, excreted, or used for animal farming and crops, that exposure will lead to resistance, and that resistance will impact all of these three sectors, which we are calling sectors for our ease of explanation. So these antibiotics, which are critical, like you said, are critical for different aspects. So for human health, for treatment of certain infections, antibiotics have been classified to an access, watch, and reserve list. So that access have low resistance potential, should be very easily available, and are first line antibiotics. Whereas the reserve list have very high resistance potential. The microbes develop resistance to these drugs very quickly, and as a result, we will lose these antibiotics for the function that we need them very soon. So but they are the only ones that act against those microbes and are needed for treating very severe infections. Now, if we use all of these categories of antibiotics indiscriminately in each sector, whether it's for a pesticide or food production or treating a human infection in the ICU, you can imagine what we are going to do with these tools. They're going to become ineffective, and that's what is already happening. when we discuss the numbers that I was talking about. And I think we've already seen an exposure in the sense during the COVID pandemic. We have seen the indiscriminate use of steroids, which affect immunity, and then we saw a fungal outbreak, mucormycosis. And that mucormycosis, which was seen like very few infections, less than 10 in a year, we had an outbreak of more than 1,000 during that 2 month period when the second wave was hitting, for example, India. So that kind of epidemic or outbreak of antimicrobial resistance is already happening. It's just invisible because antibiotics cause a range. Antimicrobial infections are a range of infections which come to the ICU. They affect a range of the age group and gender, and they are not one diagnosis or a disease that is visible to us. So as a result, we don't understand what is the great volume and the burden of this issue, and we don't address it. So unless we use antibiotics in a very prioritized manner with some critical antibiotics left for human health, some which are important for food security, which I'm sure Dr. Robin will talk about, and we monitor what's happening in the environment, this epidemic of antimicrobial resistance is already raging. With COVID, maybe it becomes even worse. And I mean, it'll be sad because there are no new antibiotics in the pipeline. No new drugs are being discovered since 1980. So where are we heading is disaster.
Thank you, Dr. Ravi. I think I agree to the very last point which you said, rightly, that we are using everything. We don't know whether we have been using it from so long, and we don't have any new alternatives as well. So I will request Dr. Robin to add into the same from a food production angle as well.
Now, when we're looking at the food production angle, essentially we should understand is that since the 50s, as I was telling previously, the production has drastically increased. And essentially, as you get richer, you tend to consume more protein. That's natural. That more richer a country becomes, we consume more protein. But let's say from an Indian perspective, we hardly have less than 6 to 7 kg of meat per head every year. While you compare us with an American or Australian, he consumes about 100 kilograms of meat every year. So actually we are short of protein in our country. But we should act very responsibly. Essentially, when you look at industrial food animal production, majorly it is two production systems in our country. Essentially, we have poultry production improving rapidly. Industrial food animal production essentially means that you grow animals on an industrial scale, maybe thousands, 10,000 birds at a go. And when the animals are crowded, especially when you look at the animal welfare part of it, when animals are crowded, they tend to fall sick more easily. Or when animal is sick, the entire flock gets affected. So you need to, instead of treating one, you need to treat the entire flock. And since antibiotics are very cheaper alternative rather than maintaining biosecurity and hygiene in the farms, so every farmer tends to use it. That's the crux of the use in food animal production. Essentially, we should understand is that food animal production, it is a business. Essentially, a person grows poultry. When you look at cities, you have those. If you look at Delhi, for example, you will have in the surrounding peri-urban areas, you will have those tabelas where cattle are reared for milk, so that the milk can be supplied to cities. So where animals are kept in less hygienic conditions, less than optimal hygienic conditions, and this is where the use of antibiotic kicks in. So when you think of that, and adding on to what Dr. Joshi was saying, essentially is that critical antibiotics are being used which are critical for human use, are being used in veterinary side. And just we're speaking about colistin. Now colistin has been banned for veterinary use in the country. So that means that for animal production side, you look at antibiotics as arrows in your cure. So the veterinary side is one arrow less. So your cure has one arrow less. So you have less antibiotics. So that's what is happening essentially is that you are losing antibiotics, and as Dr. Jyoti was saying, that no new antibiotics are coming. Essentially, look at colistin. It was a former veterinary drug, and now it's being rapidly used and widely used in ICU, and it's the last drug for many, maybe as Madam was saying, for neonatal sepsis. So you need to look at it. We need to look at how sustainable our production systems are, and what is the impact of that the unsustainable production systems on the environment, and it comes back to us, back to our human health. It comes affecting us human health. So from the food animal perspective, two ways of looking at it. One is the environmental impact. Another is those bugs, the foodborne infectious bugs, for example, Salmonella, Campylobacter. They are also getting more resistant nowadays. So two ways to look at it. One way is the number of antibiotic resistant organisms are increasing in the environment, and the number of foodborne infections are also increasing, which are slightly more resistant to antibiotics.
Thank you, Dr. Robin, for that explanatory discussion. I would like to go back to Dr. Rajeshwari, linking it to the environment side as well.
Thanks, Harsha. So I would maybe put it in a way that it's already a pandemic within a pandemic. It's just that it's not created as much havoc as COVID has. But we have already heard reports and we've already seen how secondary infections involving say, resistant bacteria has been a part of COVID, and how it has led to quite a lot of antibiotic misuse and overuse. Uh, so maybe it's already there, and we need not even wait for it for the coming days to come. But from the environmental side, again, I would maybe draw my analysis or draw my reflections from again COVID, because this would mean once this becomes into even a larger pandemic, or if I'm assuming a situation that instead of COVID, instead of a virus, it was a bacteria this time which was resistant. I think this would mean on the environmental side a greater circulation of the bacteria in the environment through waste into the larger environment. It would even mean a greater spread of infection. Unless we have existing waste management systems, unless the waste management systems are prepared enough to be able to remove this or tackle this, the wider impact would be even more harmful. Just to touch a bit on the issue of critically important antimicrobials, this is something which the use of which needs to be conserved for humans. As we've heard, they are being used, misused or overused at times by humans, or even in the food animal sector. And going into an era of going into a pandemic phase with even these critically important antimicrobials not working, just because we have not been able to conserve their use, it's going to make things very difficult with very limited antibiotics in pipeline. Yeah, thanks.
Thank you so much, Dr. Raveshwari. I think, yes, to sum up, it is like we have been using these antibiotics in animal farming, where there are chances that there are critically important medicines as well, or antibiotics as well for humans, which we have been misusing or overusing. So there we need to find a balance, that why these kind of antibiotics are not required. We might think that this is for the disease prevention, but when we give it to the animals, it might be the case that that medicine or that antibiotic, if we say it technically, might have been useful for humans as well. So I'll move on to my next question. As Dr. Jyoti was mentioning, that we are calling them sectors, people, animals, and environment, but it is a one health issue. So why this existing gaps are there when we want to control this AMR through different authorities or stakeholders between these three areas that actually work as a one particular one health sector?
So I think I can go first on this, Harsha. And we must, remember that these sectoral interventions are important, or these sectoral demarcations actually are important, because we need to administer. So to bring order, it's a very systematic way of looking at how information and data can be gathered. But what we also need to now, as we all in science are coming back to understand, is we are all interconnected. It's in terms of action. So each of the sectors is valuable for the systems that have been created and the data that is being generated. But I think what is needed is to connect those systems to work together and have a holistic, sustainable development perspective of everything in life. It's not just health or environment. It's all of these will be achieved, all these aims that we say sustainable development goals that we have, in which addressing antimicrobial resistance or hunger, like Dr. Paul was mentioning about protein, malnutrition is a problem in developing countries and it has to be addressed with farming. But having ways and means by which we don't aggravate or make work in opposite directions is important. So, so the need of the hour, the gap is there because the system that has worked so far for us has been sectoral. And what we have to create is interconnections between the sectors and its administrators, whether it is at district level, at state level, national, or even international, global level. So what we need is this platform. And I think there are the national action plans for antimicrobial resistance talk about a One Health approach. And most countries which have plans have that perspective. But turning that plan into action, because there is no set example for one, is the challenge. And each country has to come up with ways and means or to make this a reality. So what we'll require is exchange of this data for surveillance, for even discussion, having these sectoral leads in animal health, human health, and environment at a district level, just at least meet at a regular frequency to discuss what's happening with the antibiotic drugs and the resistant infections, their profile on a regular basis. Once that discussion happens, you understand the magnitude of the problem in the One Health perspective. You will need to come out with technologies that can be used to address, and we need to then exchange best practices of what could have been done in one sector. For example, the use of vaccines in animal health has been dramatic and is being used for coming up with vaccines for treating infections rather than just preventing infections like in human health. So those perspectives need to be exchanged, and this surveillance and monitoring, so that we can set targets, we can discuss that, yes, which sector is performing well, which may need some support. And we have to keep in mind all the requirements for a country or populations, because if nutrition is needed, we need organized farming. And if organized farming is needed without disturbing the delicate balance of antibiotics or the range of antibiotics available, that is what we need to monitor, and what's happening in the environment. So those structures and systems are what are missing, but yes, they can be created, and we have to start small. So hopefully the national action plans are a good way to implement these mechanisms, and that's the way forward in many states and countries.
Thank you, Dr. Jyoti. Dr. Robin, would you like to add to the same question as well?
Yeah. Essentially, yeah, as Madam was saying, National Action Plan is the cornerstone for state level actions on EMR. We should understand is that for the state, whether it's, in India we call it states or for the union government, for the government, the cornerstone for government is the action plan which it is created. Sadly, in our country, you look at it, out of the 28 odd states, only 3 states have come up with an action plan. So essentially, as Madam was saying, yes, it is a One Health action plan. We in Kerala, to admit, see, the last meeting we had was before pandemic. It was on February 2020. Yeah, that was the last meeting we had on EMR, where all the sectors meet. So the pandemic has pushed us. The focus has totally shifted away from EMR. So EMR is no more this thing, because the health sector is so held up with the pandemic. And let me tell you that Kerala still is reporting more than 20,000 cases a day of COVID-19. So the pandemic is still very much raging in this part of the country. So the governments cannot focus on a silent pandemic, because the visible pandemic is still very much raging. So that is the problem. Yeah. For animal health, as Harsha was saying, we need to regulate at least the industrial food animal production systems. At least those large farms, we need to come up with some sort of regulations. Regarding surveillance, I won't say that surveillance. At least we should be able to survey AMU, antibiotic usage in animal side. At least we should have good data in our country that how much production of antibiotics is being diverted to animal side, so that we get a measure of AMU. If you have a measure of AMU in the animal side, definitely then we can come up with a great measure of AMR, where it goes. We can really quantify the antibiotic resistance from the food animal production part, which is coming to the humans. So unless we have a good data on AMU in animals sector, it should be legislated. We should have legislations to measure the AMU in animal health. Unless that kicks in, we won't be able to control much use. And another problem in India is that we have only one drug regulator. We should understand is that humans and animals actually, looking from the One Health, actually we have a great One Health system, because the same guy is controlling animal antibiotics, the same person is controlling human antibiotics also. So actually we have a great One Health system. The drug controller remains the same, but it's not working. That's a different case. Though the drug control remains the same, uh, let me tell you from the Kerala perspective. Our drug controller in Kerala, he has about 36 drug inspectors, and he has to look after about 26,000 drugstores across Kerala. You can imagine what is his challenge. So where he will have time to look after the animal health side of it, or the sale of antibiotics. So that is the problem. So as Madam was saying, we need to have some self-regulation. We need to have some self-compliance, and we should encourage and train farmers so that they don't use much. That's the only way forward. Otherwise, I don't find how much a government can regulate. It's a tough question, because India is a vast country. Farms are spread across the country. You don't know. It's a huge country, and from food safety point of view, we look at it. In India, food safety, we don't have food safety is not a major issue, because we cannot even control the adulteration of foods which is happening in India. The food safety is after that. If we cannot control adulteration from jaggery to oil to what not is being adulterated, we cannot hold somebody responsible for adulteration. We cannot speak on safety. So we are a long way to go.
Right. Thank you so much, Dr. Robin. I think I agree that the capacity or resources are lacking right now. And we might have to come up with some strategies where we can fill up these capacity. And there are plenty resources to work for this AML in different sectors, whether it is coming to humans or animals. I will move to Dr. Rajeshwari to speak on the topic. I know most of the things have been covered. Would you like to add anything, Dr. Rajeshwari? You're on mute, Dr. Rajeshwari. Yeah.
Okay, sorry for that. Maybe I'll add a bit more, but I think Dr. Robin Paul was speaking. I mean, he was so real in what he said. That's actually the issue. When it comes to the gaps across the sectors, I think that's what we are discussing. Somewhere in one of the meetings I came across this thought that sectoral importance is important on one hand, because each sector needs to have its own responsibility. Each sector has its own way of handling the issue. So while One Health is extremely important, it's important for things to come together at the end, but at the same time each sector has its own role to play. But having said that, when I move to the One Health part of it, and if I have to think about the environment, of course, environment is an issue, is an area that has still not been, even in discussions, at par with that of the human and the animal sectors, in the light of the issue that we are talking today, which is AMR and antibiotics and drug resistance. It has, that's also because the environment, as I said in the beginning, it's been largely at the receiving end of it's been at the receiving end as a result of use and misuse that's happening in the other sectors. And also because the issue is, once into the environment, it becomes more complex. It involves multiple sources emanating waste, multiple determinants which could contribute to it, and multiple sectors. When we come to the role of regulators, or who can help manage this, Of course, it's very easy to say that environmental regulators are supposed to do it, but we must also realize that historically they have not been attuned to working on AMR or antibiotics. The larger focus has been general pollution, heavy metals, pesticides, all of this. So this takes time. You will have to train resources, you will have to have the necessary infrastructure, necessary training, necessary bandwidth to even focus on AMR, which is a completely new area that is coming up. And also there is a continuous ongoing debate of whether there is enough evidence to say that okay, environmental AMR is a problem and you start taking action. So there are too many things happening on the environmental side of it, and perhaps that is why the gap is even more evident in this case. But right now, at this point of time, there has been a greater recognition to the problem. Even at the global level, people are talking about it. The UNEP, United Nations Environment Program, has also come on board. The larger tripartite organizations who are handling the issue. It may take time, but I think there is enough evidence to say that okay, let's start taking action and focus on waste management, focus on monitoring, focus on hotspots maybe. As LMICs, we cannot do it in everything. We are not that rich, but maybe pick up areas where small actions can even lead to results, and see what can be done. So yeah, that's about it from the environmental aspect.
Thank you so much, Dr. Rajeshwari. I think yes, you have correctly mentioned that it is a very new field for, I think, environment sector. As you mentioned clearly that the focus has been only on the major areas, but this is a very hidden area which has come up now, and we need more learnings in that sector. So I will have a last question to you, and if you would like to share a message to the people who have been watching us, like how does a sustainable food system looks to you from each of you individual perspective, from your own organization perspective? Dr. Jyoti, would you like to
Maybe
start?
again, if I go first and I can
Yes,
quickly.
please.
Yeah, sure. Am I audible? Yeah, sure. So I think the only message I would have for all of us, which has been useful to learn from different speakers and their perspectives, is antimicrobial resistance is not the challenge of a person or a sector alone. Everybody has a role. And in every action that we do, whether it is for our health when we are sick, or the food that we eat, or how we use our resources or throw our waste, every action of ours has a repercussion, especially from the perspective of the drugs which are antibiotics, which we are discussing today. So I think we must introspect and change our behavior first, because in developing countries, like we have discussed a little bit, the problem of antibiotic resistance is aggravated by our demand for antibiotics over the counter without a prescription. If I say from the human health perspective, if a cold or a flu doesn't become good in 2-3 days, we go and ask for an antibiotic and we get one. So that is a behavior which we need to change. The government, the regulators, state or national level have a role, and I'm sure there are things they can much improve a lot. But this is something we can do at our own level. The food that we eat, and making sure that it is antibiotic free, or at least developed with using antibiotics only for the welfare of that animal, or the using the best infection control possible, and not discarding our antibiotics even in our houses or hospitals, in the regular waste, but managing and buying only that which is important and useful, and leaving the rest for use when we really fall sick and need them. That is what I would say, and I hope it's a change we all undertake in ourselves first, and it will be a change for a billion and our country then over.
Thank you so much, Dr. Jyoti. Dr. Robin?
Yeah, regarding sustainability, yes, we need to have a hard look at how sustainable our food systems are. Sustainability, it is a problem essentially because if you look at the planetary health, when from the One Health perspective, the animal production has already reached a state where you need to look very carefully about how sustainable your systems are. So we need to have a hard look at it. Regarding message on for the day, I would say that healthy animals and birds, just like healthy people, they don't require any antibiotics. So the key to animal production improvement is that you maintain animals in a good healthy condition, so that you don't need much of antibiotics.
Thank you so much,
That
Dr. Robin.
for me.
Thank you. And Dr. Rajeshwari, would you like to give a end comments? You are on mute, Dr. Rajeshwari. Absolutely
Yeah, I
fine.
have a lot of background noise here. Okay. So I think a sustainable food system to me, or maybe what we look at a sustainable food system is a system which is less dependent on chemicals, and perhaps which is more inclined towards pushing the preventive agenda. You know, if we are able to have the proper systems, proper biosecurity, proper cleanliness, hygiene, so that we are able to keep diseases away to the extent possible, I think the use of antibiotics in the first place will come down. And this applies not just in the case of human health or animal health, even in crop health. So that's how I would put a sustainable food system. It's not easy to achieve. It's not a thing which I have said in one line and it can start happening tomorrow. Given the population, the food demand, the conflict between food security and food safety, it's a big thing to achieve to the T. So that's how I look at it. And just on a closing note, I think I would say that maybe if we could bring changes to our own lifestyles first, and stop dropping our antibiotics into the dustbin. But then the question comes, okay, if not in the dustbin, then where? So there is a gap again. Then what do I do with it? Somebody asked me that, this was my closing comment somewhere, and then somebody said that, what do I do with it then? So there is again a regulatory issue that needs to be addressed there. So and maybe a preventive agenda for ourselves as well. A lot of traditional things that our parents, our old age parents did not need so many antibiotics in the first place. And today, like I think Jyoti said that even in 3 days we are not well, we pick up an antibiotic, pop it, because we want to get well and uh, start get going. That's how we want to be. So yeah, I think if we could bring some changes to our lives and start knowing about the issue, I also know that understanding of this issue is also, it's such a niche area. It's such a technical term. I will say AMR, not many people will understand. So even having a bit of awareness like what you are doing today, you know, even that is also something which should help in the long run. Yeah, that's how I would close it. Thank you.
Thank you, Dr. Rajeshwari. I think I was, going through social media and I read that we keep on having paracetamol, even other antibiotics, just like you mentioned, even in 3 days that we're not getting well. It has become like a snack to us in this kind of era. And I think this health burden of AMR falls on the low and middle income countries like India, like you have also mentioned, Dr. Rajeshwari, which includes uneven access to affordable antimicrobials and healthcare. It increases negative health outcomes during pandemics, where antimicrobials are needed to treat secondary infection, putting health system under extreme pressure. Keeping genetically uniform animals squashed together, as Dr. Robin was mentioning, subjected to painful mutations at sometimes and unable to express their natural behaviors is also a risk factor for emergence of superbugs from antibiotic overuse and pandemic. In addition to this, we feel that inappropriate use of antimicrobial in all the sectors, including animal farming, to compensate for poor husbandry drives AMR, which indirectly impacts food safety. And AMR in a manure spread on fields creates spillover into the environment and waterways. At World Animal Protection has done survey in 2020 across 15 countries, which found that 92% of people in India are concerned about superbugs from farm animals, and they want that animals should be treated well and antibiotics should be used responsibly. World Animal Protection India believes that antibiotics should be reserved to treat animals, not used to promote fast growth or as a band-aids across the herd to prevent stressed animals from getting sick. I think it has been wonderful discussing these different areas with all of you, and you have given a great information to our viewers today. I would like to extend a big thanks from World Animal Protection India to three of you, and thank you so much. It was really nice to talk to you and hear you today. Thank you so much.
Thanks,
Yeah,
Harsha.
thank you also, Dr. Jyoti and Dr. Thanks.
Same here. Thank you.
Thank you.